Hi guys, this video is about Sinus Tarsi syndrome, which is a condition that can give you pain over the outside of your ankle. And what we're going to look at in this video is what Sinus Tarsi symptoms feel like, the anatomy of the foot, and what actually causes this condition to develop, and then also what treatments may be useful for it. My name is Maryke. I'm the physiotherapist from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment for your injuries. You can have a look at the link to my website is in the description of this video. Okay, so let's dive right in. What does Sinus Tarsi syndrome feel like? So the main symptom is pain over the outside of your ankle. So let me, kind of there where I've made the red circle on the picture there, let me show you on my own ankle. There we go. So if you've got your ankle bone, the lateral or the outside ankle bone, this side, your fibula, then the pain from Sinus Tarsi syndrome sits very much at the front there. And it can feel very similar to an ankle sprain, but it feels quite deep in there as well. You can have local swelling over the area. Then walking around, your foot can feel a bit unstable, as if you want to go over on your ankle when you're walking. And then it's usually worse after you've done sport or you've walked on uneven ground, and you'll understand why that is in a minute. So to understand why this condition develops, it's quite useful to first get a basic understanding of the anatomy of the foot. So if you look at that picture that's up there, you can see the two bones from the lower leg coming in, tibia and fibula, and they form the upper dome of the ankle bone. And right in them sits a bone, one of your foot bones called the talus. And that joint is where most of the, get my foot up there, up and down movement in your ankle happens, at that big joint. Now, the joint that's involved with Sinus Tarsi syndrome is the one underneath that. So the talus, which is the one that sits there, then also rests on the heel bone or the calcaneus, and that forms the subtalar joint. And that's where the Sinus Tarsi is. It's a canal in the between the calcaneus and the talus. So let me get this picture up, then you'll see it from the top. So that's looking down from the top at your leg, and you can see it's that little canal in there, or little, what do you call it, indent nearly there on the side of the foot. So if I close that one again, that one is a bit of a picture for me. So the subtalar joint between the calcaneus or the heel bone and your talus is where most of your turning in and turning out of your foot happens. So where's my foot? I always go for the wrong side. So foot, yes, that's it. So in and out movement. So we're thinking pronation and supination happens at that talus, at that joint. And that leads into what actually causes Sinus Tarsi syndrome. So it can be through a single trauma, like you sprain your ankle, or it can be repetitive ankle sprains that brings it on. It can also be after something like an ankle fracture that you get these symptoms. And it's usually in these patients you get ongoing instability in the ankle. So what happens with instabilities is you can either have a functional instability or you have a structural instability. And what's the difference? Functional, your ligaments and everything is intact, your bones are fine, but your muscles aren't controlling your ankle very well. So the ankle's moving too much. When you're walking, it feels as if you're constantly going over on your foot, even though you're just walking, not even running. That would be a functional instability. A structural instability is where the ligaments aren't actually stabilizing the joint enough. So you've sprained your ankle and torn the ligaments, and they've either not grown together properly or they are too lax. So now you lack a bit of stability. Now for people with a functional instability, where it's the muscles that's just weak and not doing their job, rehab exercises works really well to get that back to normal. For the guys with a structural instability, it depends on how bad the ligaments are injured, what type of activities you want to be doing, and also how much pain you have, whether a rehab exercises will make much of a difference there. Often people need to go for surgery if they've got a structural instability. But you always try rehab first, because for some of them it actually does work. So why would an instability cause Sinus Tarsi syndrome? Now, remember that joint, the subtalar joint between the heel bone and your talus. Joints are lined, or synovial joints are lined with, they've got a capsule around them, and that capsule is lined with a synovial membrane. Now, when you constantly irritate that membrane by going over on it too much or pronating when you're walking, it becomes irritated and causes inflammation in that lining. And then the lining thickens and it starts to catch in the joint and in the sinus tarsi canal. And that can cause quite sharp pains and swelling and things. Also, if you've got ligaments that's torn and not grown together and they've got a little bit sticking out, you can actually catch that in your joint while you're walking. And that can be part of the cause for your pain there. So you can see that ankle stability is a very big issue when it comes to this type of injury. So how do we get rid of it? It's a combination of things, and you always want to try 6 months of conservative treatment first before you consider surgery, because this is something that can calm down, even if it's a structural instability, with conservative treatment. Now, I'm going to run through all the conservative treatment options you've got, but what I find is it's usually the combination of a few that works well, not just one on its own. Like, for instance, the first thing you could do is use anti-inflammatory tablets, because especially in the early stages of this condition, it can calm the irritation and the inflammation in that lining down and cause the swelling to go down so that it doesn't catch anymore. Remember to ask your doctor before you take any medication, because it can have negative effects as well. But now, if you take anti-inflammatory medication, but you change nothing else in what you're doing and how you're walking and your strength around your ankle, you will just continue to irritate it. So this will calm it down, but this will irritate it again. So you've got to combine a few things. The next thing that you can use is semi-rigid orthotics. Now, orthotic is something that supports your arch when you walk and stops your foot from turning in so much or pronating so much when you walk. And I find that can be extremely useful for these patients. It doesn't mean that you're going to have to use orthotics forever. Some people will have to, especially if they've got a structural change there that the ligaments aren't supporting properly. But if it's just a functional issue, you can retrain your muscles to support your arch and everything properly. But just for that acute stage, where you're really struggling to calm the joint down, I find a combination of orthotics and then all the other treatments is really useful to just stop that ankle from going in. You could use taping as well for it to stop it from turning in. But the problem with tape is that you've got to reapply it often, and it can really irritate your skin after a while. So it may be useful if you want to be playing sport to use tape or even an ankle brace or something instead of just orthotics. But it has to be kind of tailored for what you need there. Then thirdly, it is rehabilitation exercises. So what happens when you sprain your ankle or injure your ankle is quite a few things. One, the pain often switches the muscles off, so they just don't fire as quickly, they don't contract as strong as they should, and they become weak over time depending on how long you've actually not rehabilitated them properly. There's not one single muscle that you need to rehabilitate. It's pretty much everything around the ankle and in the foot you've got to make sure is working properly. So we're talking about the movement that pull the foot up, so dorsiflexion, plantar flexion, inversion, eversion, all those directions you've got to strengthen. Exercise bands can be good for that. Balance boards where you control it slowly can be good for it. Just make sure your foot posture is good on that. Heel raises, weight training, all of that can be good for it, but it has to be set at the right level for your injury. If your sinus tarsi syndrome is still really painful and irritated, jumping right in with strong rehab exercises will actually just make it feel worse. So you've got to have it set at the right stage for your ankle. Now, it's not just about strength, because we need to change the control and the way you move your foot. I actually want to see if I can show you my foot. Yes. So if we think about it, so like I said, part of the problem with sinus tarsi syndrome is if you have an unstable ankle. So it's turning in too much, and you can see what happens if it turns in a lot. It's going to compress that area and irritate it further. So what we want to teach you is where's a nice neutral position for your joints. Everybody's slightly different, but you can see this one will allow much more space and less compression there than if I stood like that. So I would want to strengthen my feet in this position. So all my exercises that I do, I want to always return to a good position. Then another thing that's important with that is you have to retrain your balance and your position sense. Now, what is position sense? It's basically, you know, when you close your eyes, you know where your fingers are, you know where your toes are, you know where everything is. And that's because there are little receptors telling your brain where everything is. Now the problem is those receptors are in your joints and they are in your ligaments and in the tendons of your muscles. So as soon as you sprain your ankle, you mess that message up a little bit. So now the brain doesn't know exactly where your ankle is and how fast it's moving, and how high or low it's moving, in what direction when you're running around or walking around. So you've got to retrain that. And it's not rocket science. It's literally starting with just balancing on one leg. But again, if it's painful to balance on one leg, you've got to adapt it that it's not painful. So you've got to find positions and ways of doing it that you can do it pain-free. With this condition, you really don't want to feel pain while you're training it. So yes, balance exercises, but progressive balance exercises. So we usually talk about static balance and dynamic balance. So static balance would be balancing on one leg, balancing closing your eyes, those type of things. Dynamic balance would be balancing on one leg but doing something with the other limb, for instance, or maybe jumping and stopping, or anything where you move but you've got to balance. And you have to progress to that, because you can see the problem with if you can just balance in one spot but you actually want to go running, then the balance may not be good enough for that, or the proprioception. So you have to kind of progress that over time as well. What am I leaving out? Oh yes. Now, all of those rehab exercises I've spoken about is concentrated for around the foot. But don't forget about your butt, because when we on one leg again, how much of myself can I get in there? I think I'm going to make it down. Yes. So when you're on one leg and you do a single leg squat, your knee is meant to move in line with the middle of your foot in a nice straight line. Now, if your glute muscles aren't strong enough, let me do my left leg, you'll see it better, then your leg will turn in as you do that. And see what happens at my foot if I balance on one leg and now my leg turns in, it pushes my foot in. So if your glutes aren't strong enough and they're not controlling your hip properly when you walk around, that will actually cause your foot to overpronate. So it doesn't have to be the foot's fault that it's overpronating. It can actually be coming from higher up as well. So make sure that you strengthen your glute max, your glute med, and get everything else in the leg strong at the same time. Then, if you find, with regards to exercises, please don't go and stretch dorsiflexion or deep dorsiflexion. So what do I mean with that? You know that classic stretch where you stand like that and runners stretch their calves? Actually, can I get into the shot a little bit better without moving anything? Yes. So it's that stretch. You want to avoid that. Can you see that it's going to compress in there again? So if you find that it's continuously staying painful, it may be that you're actually doing exercises and things that you think should be helping, but you're doing them at the wrong level, or you're doing things like stretches and stuff that's compressing it. So really just think about what you're doing and when you're doing it. Now also sometimes, especially if you've had this condition for a long period of time, it can just be so painful and irritated that it doesn't want to calm down through all of the things that I've just spoken about. And then a corticosteroid injection can really be useful. In the practice that I used to work in with the sports med doc and everybody, it was so handy, because if we got one of those patients, the sports doc would usually send him for physio first. If we start rehab and stuff and we see we can just not get going with things, despite doing all the other stuff I've just spoken about, I would just refer him back to the sports doc and they would do a corticosteroid injection into that sinus tarsi. But it's important because you want to get that injection right into that little hole there. So it's got to be done really under ultrasound guidance. A blind injection could work, but only from a really skilled person. So it's better if you've got somebody who can actually look at where they're injecting while they're doing it. Now, if you've done all of this and you've tried a corticosteroid injection and it's still not worked, then surgery may be an option for you. Now, what they do in surgery, they can do one of three things. They can go in and just trim the fat little bits that's causing the trouble away, so the synovitis and stuff where it's got little bits that's sticking into the joint and catching. And if there's loose ligaments and stuff, they can just trim that away as well. And that does seem to work really well for some patients. Then other patients, especially ones who's got quite a severe instability, structural instability in the joint, and the foot sits in a funny position, they may benefit from actually having surgery that reconstructs the ankle and where they stabilize and put artificial ligaments in. And then lastly, they may decide to combine both of those, that they trim away little bits that could be irritating and stabilize it. So it just depends on what the surgeon feels is best for you. Now, let me know if you've got any questions, and if you need more help with an injury, you're always welcome to consult me via video call. Link to the website is in the description of this video. Take care.